Yeah.
Papa, do it again.
No, it's okay. You just let it go.
Okay. My name is Andre Svensson Rothberg, and I've lived in Sweden for now 11 and a half years.
My name is Fiona Rothberg, and I am almost 48 years old, and I have lived in Sweden for 12 years.
My name is Niklas Svensson. I am Swedish, and I am 45 years old, and I lived in Sweden for most parts of my life. The Swedish healthcare system is built on a primary care system. So every citizen or any person in the country has access to a primary care physician, and it is financed through our taxes, and it is managed by the municipalities. And then above the primary care system, we have a number of specialist care facilities in Sweden. In each province there is at least one major hospital that has expertise across the areas of healthcare. But also for the abortions, this is not a political issue in Sweden. It is a right that's being offered without any debates in Sweden. Really, there are only a very small party that argue in a similar way as some of the major parties do in the US. But they are very small and a minor party. Women have basically no major issues in reference to sexual reproductive health. I do believe that the universal healthcare system invites people from the early age and enable them to learn about health, which is extremely important. That young girls and young boys learn about the importance of health, brushing teeth, hygiene, showering, etc., etc. That all these things are something that you learn about and help staying healthy, but also enable you to access the learning enables you to access the public healthcare system.
Growing up in the United States, I am very used to the fact that people not only help each other out, but volunteer not only their time, but are willing to give money in a different way. For example, by whether it's giving to a yard sale or giving to a bake sale, or giving a little bit of money to a school or something to help not only their own children but other kids in need. And here the system is set up in a way that everyone is cared for in a very equal manner, so there isn't as such a need to help needy, if you will, or provide for people who are less well off, because people are more equalized. And that's due to laws and the welfare state, where we all pay taxes. No matter what, we pay taxes, and it's dependent on how much you earn, how much your taxes are. So the more you earn, the more you give to the state with your taxes, so that you can provide for people who are less well off. Okay, so there are people from Romania who often come here in an organized fashion, in groups, and they are begging on the street or in the T subway areas, and Swedes typically in this society aren't used to seeing that. And they have the right to be here, to come and do that, but it's not a law to beg in that way. They're discussing whether it should be, and it's a discomfort level because it doesn't look nice. You feel badly for them. You don't know how to meet them, sort of how to engage with them, and it has led to a debate, for example, as to should we be giving them money here on the street, or should we be giving state to state? Should we be giving them help financially in their home country, where they could potentially be better off in their home country and they would stay there?
The current refugee situation over the past 12 months has been historical. Sweden has received about 200,000 refugees, which is about 16 million refugees coming to the US in proportion to our populations. So that puts things in a perspective, and I know that in smaller towns and cities in Sweden, where many refugees have arrived to, it has been difficult for those towns and cities to accommodate the needs of the refugees. The refugee crisis in Middle East and then later Europe and Sweden have put a lot of pressure on the Swedish healthcare system and the social system in general, in terms of accommodating both the people and their needs. We have, as a nation, I think, and also as state agencies, been unprepared to meet these mental illnesses that people come with, post-traumatic stress disorders, as well as just regular checkups. And especially the small towns and the cities in Sweden haven't been able to meet those needs, which of course raise concerns, given that we have a commitment to accommodate the people and meet their needs.
Nice to meet you.
Thank you. She's doing a school project. Okay. Things happening in Sweden right now. This is why she's filming. Is that okay? Yeah, it's okay. It's okay. We just have a quick question to make y'all film. What law are you demonstrating against?
There's a new refugee law that came in July, but there's a part of this law that says that everyone will get permanent, not permanent resident, permanent resident for 13 months. We are protesting against the part that said we don't agree that the people came before 24/11 to 2015 should be included. That date is the date of the proposal. Everyone came before the proposal of the law should not be included in the law.
Okay.
This is our promise.
Thank you so much. So, 24.
Having universal healthcare, did you find that growing up in America that it would be a possibility for America to kind of form something like it, or does it seem unlikely?
Let's see, that's a big question. I think you're sort of comparing grapefruits to grapes, because in Sweden we're not even 10 million people, and so historically it's been very homogeneous, and you've been able to create not only a society but a legal system that includes health and health care that you can roll out on a much easier basis when you have fewer people in a country. That's one thing. So there's the size, the sheer number of people. And I think it's also a cultural dimension that you can't overlook in the US and Sweden, the differences. And the cultural dimension here again is that because it was so homogeneous, and people respect authority, and people follow directions. We're very good at following directions here, and doing as we're told by the authorities. That if the authority says, this is what we're going to do now in healthcare, and this is what you receive and what you don't receive, then people will go along with it. And culturally, I think in the US it's much more, I do my thing, you do your thing, we have a right to do that. And also typically, I think in the US there's the more well-off can afford better health care. So there's a lot needs to be thought through and changed, obviously, legally, before somewhere like the US can adopt a similar healthcare system. I think it would be good. Some similarities would be very good.
I do believe it benefits the society. I think that are fewer people in Sweden that stay outside the healthcare system, meaning that they would not choose to not see a doctor. I know, for instance, in the US, in the southern parts of the US, Louisiana or Alabama and these states, there are populations that prefer not to see a doctor because they don't have the insurances. I think that the poor populations in Sweden, especially among migrants, coming from Africa, coming from Middle East or Asia, sure, they might have a different history and tradition in seeing doctors.
Okay, generally it's a good thing. Absolutely. I 100% believe in it. The safe, yes. Have I had concerns? Yes. For example, my mother died of a horrible disease that is not very well known, and there's still a lot of research going on, and she needed a lot of care. If I were to have a disease like that in this country, I would feel that I would be better off in the US. Why? Because there's more knowledge, there's more access. You can actually get into a system where the best healthcare in the world is. And I come from a place, Boston, where the best healthcare in the world is located. So I would feel hard-pressed not being able to take care of that option that I know exists. Now, another example is, we'll take breast cancer as an example. In this country, I was amazed when I first landed here that within months I got a letter, and the letter was sent from a hospital, and it said, you are now in the system, meaning we know you exist, we know that you are in the Swedish society, and that means that you need to come for a checkup, for a breast exam, because you're over X age. And I thought, how do they even know I'm here? But that's a good thing. So they have control over you, sort of Big Brother is watching, in the sense that they know that you need to get checked and everyone needs to get checked, and they offer that service. And everyone goes and does that, and that way they can save costs. Because if they screen all of us, in this very concrete example of breast cancer, if they screen all women, they know, or they're more likely to catch the cases, because cases cost money. So a lot of it is about cost savings in both systems. So I think this system saves a lot more money in the long run. However, I think because they want to save money, then they may not offer things that some people need. In high-risk breast cancer cases, for example, everyone is still sort of fairly equal. Or in the case of ALS that I mentioned about my mother, I think I would have to advocate and fight hard to get the care that I needed. Now why? Again, and I'm almost done with my sort of example here, is that there's a queue system here. because everyone is equal, you would have to prove on your own that your case is more important than someone else's. Therefore, I find it hard as the patient that you constantly have to advocate to be seen, whether it's something serious or whether it's something small, like eczema or something. You still have to advocate that you need to be seen, and that gets tiring.
So 2 years ago, I played a lot of soccer and hockey, and then I got a really bad knee injury. So I went to the doctor and I had to work for 2 months on my knee until I could go back to my sports and hockey, soccer. They were trying to make me feel better, like not just, oh, take this medicine and do stuff. They always like tell and elaborate really well what stuff I should do, which medicine I should take and stuff.
The taxes in Sweden are considered high. They are among the highest in the world. I think they are on average as high as the Nordic countries, Norway, Denmark, some other northern European countries such as Holland pays also not exactly the same level, but fairly high level of taxes as in Sweden. I think that taxes are high, but the benefits that we gain from paying taxes in Sweden make sense, because the state offers public services and has done so for many years, for decades, as it has built the Swedish welfare system since the 50s after the Second World War. And it is a part of the Swedish society, and there is an acceptance among many Swedes to pay higher taxes, with the expectations that childcare is free, school is free, university is free, that public health is free, medical is not free but is largely subsidized. Dental care for children up to 19 years old are free. It is subsidized for adults. The elderly care is managed by the government. So the social service system is well developed, and it does of course cost money. And it is recognized as a challenge to the society, how to finance it, because our population is getting older, so there are fewer people who can contribute to pay taxes, and therefore there might be deficits at times, and therefore it is very important that the number of people who are employed and have a job are as many as possible, and therefore we have a need for people from overseas, migrants, foreigners, to come and work and contribute to the Swedish welfare system. It's a functioning system with its challenges.
What did you find first coming here, first living here, the biggest kind of thing that jumped out at you here versus America?
Anything. People didn't speak. They don't speak to you. So it's very quiet and very isolating as a foreigner first. People do not say hello necessarily or offer any kind of eye contact. So that's what I noticed.
Thank you very much.
You're welcome.